Hello and welcome to the channel on andrology and men's health awareness. Now this is the second video in the series of erectile dysfunction videos. Here I will discuss the management options for erectile dysfunction. So first comes the conservative management. In cases of mild erectile dysfunction and in cases of psychogenic erectile dysfunction, first most important thing is counseling. Counseling the patient who is having good morning erections, that is a normal functioning erectile apparatus, erectile system, counseling them that they are normal and just giving them a small dose of supportive medication generally helps these patients, and counseling as a couple also helps these patients. So for patients who are having psychogenic erectile dysfunction, psychological erectile dysfunction, there are some simple measures and this can be done. This is generally achieved when the couple visits an andrologist. That's a simple one. Second most important measure which applies to all kinds of erectile dysfunction is the conservative measures. The conservative measures include simple measures. The first and foremost is aerobic exercises. 45 minutes to 1 hour of aerobic exercise daily can go a long way in reversing the endothelial dysfunction, that is the dysfunction of the vessels in early erectile dysfunction. That is the first. Another one would be weight loss, because obesity, the fat cells, they reduce toxic oxidative substances. These then can affect not only the erectile apparatus, that is the vessel to the penis, but also to the heart and the brain. So that is very important. Second would be weight loss. Next would be diet control. The diet control would be a diet rich in salads, fruits, vegetables, and lesser of red meat and less of processed food. This will go a long way in achieving that healthy lifestyle. So that would be the third measure. The fourth measure, hypertensives, a low salt or salt restricted diet is very important, because increased salt will lead to increased hypertension. Hypertension can lead to turbulence in the blood flow. Turbulence can lead to narrowing of the vessels. Narrowing of the vessels, the first of vessels to be affected is that of the penis, and hence one should have a control in hypertension through antihypertensive medications which are prescribed by a physician, and also have a diet which is salt restricted. And for patients who have lipid derangements, that is hypercholesterolemia, they need to be on lipid lowering drugs. This also leads to a stoppage in the progression of erectile dysfunction due to the dyslipidemia, hypercholesterolemia, causing the plaques, that is deposition of the fat along the arteries and causing the narrowing. So that is the conservative measures. Now the three main treatment modalities, once the conservative measure and the counseling has been done, that is the oral medications, intrapenile injections, and the third and the last, which should be last, not done before, is, because it is reversible, is the penile prosthesis or the penile implant, commonly which how it is commonly known, penile prosthesis or penile implant. So we'll discuss in this video oral medications, and there'll be separate videos for intrapenile injections and intrapenile prosthesis, that is penile prosthesis, because they are advanced therapies and they require specific training on not only in the part of the andrologist but also in the part of training the patient on how it can be beneficial to them. So first is oral medications. The oral medications, they act via a mechanism via via a mechanism of increasing the release of nitric oxide, that is a smooth muscle relaxant, that is a muscle relaxant. For instance, in common language, muscle relaxation causes the blood which is flowing into the penis to get engorged and retained into the penis rather than flowing out. So these oral medications release nitric oxide and they cause dilatation of the arterioles. Dilatation of the arterioles, the increase in flow, those arterioles become dilated to the penis. There is increase in blood flow, and then nitric oxide causes retention of blood flow. So that is how the oral medications act. And these are the common ones which we know. There is Viagra, that would be sildenafil. There are different doses of sildenafil, 25, 50, 100. So then that the dose to be started and how it has to be done has to be individualized as per patient counseling and patient requirements. And then there is other drugs, tadalafil, vardenafil, and a new drug is avenafil. So these drugs all have different efficacies, different time of action, and when used adequately as per the history of the patient and the couple, they can act effectively. These can be used either as daily dosing, as in as we take, as patient has hypertension, he has to take antihypertensives. Similarly, patient has erectile dysfunction, he has to take these medications These can be taken daily, as in the medication as we take for thyroid, hypertension. These medications can be taken daily, or they can be taken on demand for an additional dose, additional potent action at the time of intercourse, so that to be sure that one is able to achieve successful intercourse and satisfy the partner. So this can be either long acting, daily dosing, or it can be on demand dosing. This has to be discussed with your andrologist. A word of caution: these drugs, oral drugs, which are called PDE5 inhibitors, commonly should not be used in patients who are on nitrates. Nitrates are generally used in patients who have angina or who have heart disease and they have chest pain and they are told to pop in a pill just below their tongue, and this causes hypertension. And if taken along with PDE inhibitors, which cause vasodilatation, that dilatation of the arterioles leading to decreased pressure in the other vessels of the body too, this can lead to a very severe fall in BP and blood pressure, that is, and thus they have to be avoided. That is, nitrates and the drugs for ED, that is the PDE5 inhibitors, do not go hand in hand, and this is a very important word of caution, especially for patients who have heart disease. There are no other contraindications. A very big misconception among people is that, oh, I'm taking this medication and there is some vasodilation throughout the vessels of the entire body. There is some warmth, and sometimes there is some blurring of vision initially, especially in the initial phases when one starts the tablets and the patient feels that, oh, this is causing some effect on the heart or on the body, but this actually is causing vasodilation and increase in blood flow to all the organs in the body. And hence the only major contraindication, is the heart patient who is taking nitrates. Otherwise, patient with hypertensive, diabetics, or thyroid disorder, or any other diseases, this drug can be taken concomitantly and one can achieve successful results rather than being worried about the side effects. They have very simple side effects which are due to increased blood supply, and they do not affect the heart or the brain or any other vessels. This is very important because of these misconceptions, people do not take these tablets and they do not succeed. So that is very important. Along with conservative measures, counseling, and these drugs, most mild cases can be treated. So this was about the oral tablets which are there for the treatment of erectile dysfunction. Next, erectile dysfunction or impotence. The next video will be on intrapenile injection. So this is going to be a little more detailed video, or a thing which people are not very much aware of, and I will be discussing in the next video. I hope you like this video. You can leave comments, any queries which I can include in my further videos, and kindly like and subscribe the channel. Thank you.